Back now to our top story and new developments today with the measles outbreak that's been spreading around southern Ontario. A school in Kitchener closed today because of an exposure alert. The Guelph area continues to be considered a high-risk area for transmission, and the province is now out with its latest set of data, confirming the number of cases that they've been tracking have surpassed 1,600. Let's get the latest on these developments as we bring in Dr. Matthew Tenenbaum, the Associate Medical Officer of Health for the Wellington, Dufferin, Guelph Public Health Area. Dr. Tenenbaum, good to have you with us. A very topical conversation today. Thanks for joining us.
Thanks for having me today.
Let's start by the situation in Wellington, Dufferin, Guelph by looking into that a little bit. What are the latest figures you have when it comes to measles cases?
So as of right now, we are at 68 cases in our community. That's people who have been lab confirmed, as well as people we consider probable cases. And that number has been increasing, in particular over recent weeks. We have seen some changes in the dynamics of measles spread, and we are seeing it affect people across all parts of our geography, particularly those who are not up to date with their vaccines.
How would you characterize the level of spread that we've been seeing in recent weeks?
So I think the context is important. Ordinarily, measles is not something we worry about. It has been eliminated in Canada, which means that we don't typically see outbreaks, and that's been our status since the late 90s. So, in a previous year, we would have had a bad measles year if we had maybe 10 or 20 cases across the entire 12-month period. We're now at a place where we have 1,600 or so cases associated with this outbreak across Ontario. So it is much, much worse, and we are seeing a lot more than we are used to seeing.
Now, perspective is important. You mentioned over 1,600 cases. Ontario's update today showing 1,622 cases. We know there's usually a bit of lag with that data. So do you expect the number to keep growing as exponentially as it has been? Or how are we going to know when we've plateaued with this outbreak?
So we are seeing, every time Public Health Ontario updates their data, about between 100 and 200 new cases added to that total every week. So we're growing. We're not growing exponentially, but we're certainly growing a lot more than I'd like us to be growing. There is a lot of work happening, both within our public health unit as well as with key partners like family doctors, for example, to try and limit that spread by offering vaccines and following up with people who have been exposed. And that's keeping that number lower than it otherwise would be. But measles is a very, very infectious disease, and we're challenging ourselves to do our best to contain it.
And that's probably why we're hearing about terms like high-risk area for measles. I wanted to just ask you sort of who comes up with that designation, how it's determined, and why Wellington, Dufferin, Guelph fits that category, or at least did fit that category recently.
Yeah, so a high-risk area for measles, that status is basically determined by the health unit, in our case it's WDG, working closely with the province of Ontario. We have regular communications through teleconferences with our provincial colleagues to keep each other updated on the latest with the measles situation. It used to be, when this sort of first began in Ontario, there are particular areas along the Lake Erie shore in the southwestern and Grand Erie health units that were most affected. And as the weeks have gone on, we've seen more and more of the southwest of the province become an area where measles is actively spreading. And so those initial risk areas have expanded, and our health unit area is now part of that expanded geography. There are a total of 10 public health units that are part of that area that are affected. And the meaning from that is that it reflects that measles is spreading, and it also reflects that we want to get people vaccinated earlier. There are particular vaccine recommendations we have, and we do want to get people vaccinated against measles earlier than usual, move those doses up to younger ages because of the higher risk of measles we're seeing.
Prevention aside, Dr. Tenenbaum, I wanted to focus on the response for just a moment, because you've no doubt heard about the closure of Eastwood Collegiate in Kitchener today because of a case that led to exposure concerns. The dates that we're getting in terms of the exposure concerns are about a week ago. So as time goes on, how difficult, or what are the dynamics involved in containing the spread, especially in a setting like a high school, I might add?
Yeah, so unfortunately, as I mentioned, measles is very easily spread. It basically passes through the air from person to person. So if you have someone who is infectious with measles inside a school, others who are inside that school are at risk of being exposed. And a single case of measles in a school can have a dramatic impact on that school population. Fortunately, people who are up to date with their vaccines, meaning they've gotten 2 doses, we are not worried about them being at school, but everyone who's not up to date has to be out of school during the 21 or so days following the measles case's last day in school. So it's very disruptive, and it's one of the ways that measles is impacting our community.
Is this very different from the way we were tracing and contact tracing and responding to COVID, or are there some parallels here in terms of what public health is able to do?
I think there are some parallels in terms of the public health roles. We think about who is ill, when were they ill, where were they during that time period, and therefore who else could have been exposed. Those basic roles and dynamics are the same, whether it's measles or COVID, but there are a couple of key differences with measles. First off, measles is much, much, much more easily spread from person to person than COVID was. We think that if you put someone with measles in an indoor environment with 100 other people, assuming no one has vaccines, 90 or more of those people will get measles as a consequence of just being inside that same room. Measles virus hangs out in the air for 2 hours after someone leaves, so it's very easy for someone who has measles to pass it on to many other people, certainly faster spreading than COVID is. The other thing is that with measles, we are fortunate to have a very effective vaccine, and we are seeing this spread despite the fact that we have so much of our community immunized. We have 90+% of our community, depending on where you look and what age group you look at in Ontario. And if we didn't have that vaccine layer of protection, we would be seeing incredible numbers, even beyond what's being reported right now in terms of measles cases. With COVID early on, we didn't have that vaccine. With measles, we do, and much of our population is already protected because of that.
So a lot of potential here to stem this outbreak. I wanted to touch on one more thing in the very little time we have left, Dr. Tenenbaum. And I suppose this is a good thing. We are starting to see more exposure locations get identified. Information is key in helping us all navigate this. What's the most important thing to remember if you look at one of those lists and you go, I was at that shopping mall that day, or I was at that concert that day?
The most important thing to know, whether you're aware of an exposure to yourself or your family or not, is just to know your vaccination status and the vaccination status of those you care for. So we are recommending that anyone who was born after 1970, including young kids, have 2 doses of measles vaccine to be considered fully protected. If you were in a setting or your child was in a setting where there was measles, but they've got 2 doses of vaccine on board, they are protected. The vaccine is incredibly effective, over 99% effective at preventing measles. It's the people who aren't up to date with their vaccines who we worry about, and those are the people who need to get their vaccines. If you've been waiting, now is the time. Public health, we will always do our best to follow up with anyone who we know was exposed to measles, who could be at risk. But certainly if you know from one of these public exposure notifications that you were exposed and you're not up to date, contact your public health unit, contact your family doctor or your primary care provider. You may need to be isolating for a period of time. You may need to be monitoring for symptoms, and you may want to take the opportunity to get your vaccines up to date.
Okay, we've got to keep our eye on it. A lot to unpack today in this conversation, but Dr. Matthew Tenenbaum, Associate Medical Officer of Health for Wellington, Dufferin, Guelph, we appreciate your expertise in helping us do so. Thank you so much.
Thank you very much.